and welcome to Return to Ski following an ACL reconstruction, hosted by the Alpine Training Project. My name is Mitch Owens. I'm a physical therapist here in Seattle, Washington, and I'm joined by my fellow co-founder of the Alpine Training Project, Mandie Majerus, also a physical therapist. In this webinar, we're going to be guiding you through all the ins and outs of Return to Ski following an ACL reconstruction. Just a little bit about myself to start. So like I mentioned, I'm a physical therapist here in Seattle. I own a private practice with my wife, and we started about 15 years ago. Our practice focuses on and specializes in the treatment of outdoor athletes. We started those programs with programs for rock climbers, and the success of those programs really led us to want to build more for outdoor athletes. And right about the same time that we were really just getting traction with our climbing programs, there was critical mass of research coming out demonstrating that programs that addressed strength, mobility, and dynamic control, these programs were having a tremendous amount of success in preventing ACL injuries for field sport athletes. And so I was really motivated by that research to develop something that would apply to skiers and hopefully help skiers, start their season strong so they could go out and perform really well and have a great season from that standpoint, but also hopefully reduce their chance of a knee injury. So that was when I reached out to Mandie, who's a therapist that I've known for a very long time. We were involved in our early orthopedic manual therapy training together. And through Mandie's involvement with the U.S. ski team, which she'll touch on a little bit later, I knew that the two of us together could really, at least get started with a solid program. Later, we brought in a third partner, Kristen Vaughn, who's not going to be in the webinar this evening or whenever you're watching this. And she really helped us to develop the programming that eventually launched Alpine Training Project as a product. So alpinetrainingproject.com was launched shortly after Kristen joined us, and that was where we were taking the programming that we had developed, this evidence-led programming, and hosting it in an online format where skiers and snowboarders could train from home and then launch into their season. And that fortunately happened all right about the time that the pandemic hit. And so the timing wasn't so terrible, right? So people were locked up in their homes, and we had a program for them to work on, since skiing was probably one of the few options they had for activity around that time. And so from there, the program really evolved year over year. I mean, we've been doing this for 8 years. And each year we're tweaking the program a little bit, either reshooting the video formatting and making it more of a continuous workout format, which it is today. And then now in our latest evolution of the program, we are now training physical therapists to be instructors and to bring our program to their clinics, where they can then do what we've done here at our practice and attract the clients that they want by offering them a really valuable product that will help them not only get ready for the season, but also, reduce some of those aches and pains and potential for, larger injuries like an ACL tear or rupture. So, that's a little bit about Alpine Training Project, a little bit about myself. I'll give you a quick overview of what we're going to be covering in this webinar. So before you get your pen and paper out and start furiously taking notes, we can save you the trouble. We're going to be providing you with a copy of the outline that we're using to guide this talk. And so we're providing references and some of the facts and figures that we'll be referencing for you to go ahead and take a look at as you're, and to follow along with as you're watching this webinar. In addition to that, we're providing you with a really valuable resource. It's a template for return to sport testing calculations On there, we have calculations for quad to hamstring ratio, torque to body weight ratio calculations, quad to hamstring ratios, limb symmetry index testing. So kind of all the things that we're going to be talking about as best practices for making those return to sport decisions, which can be challenging at times. So we're trying to arm you with research, with best practice and a means to calculate and get some of the numbers you need to make tough decisions regarding returning somebody to, the high impact, high intensity activity of skiing, depending on who the athlete is. So we'll be laying out and defining for you the return to sport phase and what that means, and then what criteria an athlete needs to meet in order to qualify for that level of activity. And from there, we'll be going through and defining what we feel is and the evidence suggests is the best set of parameters and set of exercises and activities to add into that sport-specific phase, and kind of what outcomes you should be training towards, so you can get them to the finish line, get them to that return to sport session that we all look forward to with our patients. And then we'll be doing a bit of an overview of what this instructor training program is towards the end of our talk. So with that, I'll go ahead and introduce Mandie, and she can kick off her part.
All right, thanks, Mitch. Like Mitch said, we're both physical therapists as well as Kristen, and I'm originally from Bozeman, Montana, and grew up skiing mostly inbounds there, actually. And then when I moved out here, got more into backcountry skiing and ski mountaineering. And I've always really enjoyed working with skiers and snowboarders and just outdoor enthusiasts. And I work over in Kirkland at Lake Washington Physical Therapy, and Mitch and I started working together when we were going through our manual therapy certification, like he said, and kind of put our heads together and created a bit of a movement screen that we were sharing with ski patrollers as well as our own patients in the clinic, as well as friends on hut trips, and just decided to put a little bit more together into what we now know as Alpine Training Project. And I myself have been in the medical pool with US Ski Team for 16 years, and sometimes that looks like standing at the top of a course, getting ready to ski down if someone gets hurt during a World Cup race, and sometimes that's a NORAM event, sometimes that's a camp. And the camps offer a really good lens into sort of what it looks like when someone's coming back to the snow again after an injury and the different phases there. And kind of took that back to my own patients in the clinic, and just had a lot of fun with it. And kind of through the continuing education world, got my OCS and SCS and CMT, and also with a certified strength and conditioning specialty, kind of tried to incorporate that strength training component. And I think our biggest thing going forward with Alpine Training Project, and then the science behind what we're doing today, is gone are the days where we just look at how many weeks or months someone is post ACL, and we really need to look at various benchmarks of how people are moving, what strategies they're using, what their compensation patterns are, and really making sure that we don't test just against a weaker contralateral limb, kind of the two flat tires analogy, if someone's been deconditioned on the opposite side, and being a little bit more testing, not guessing about it. So going into kind of the considerations for the return to sport phase, we don't think of return to sport as returning to the highest level of your sport. That's where you're just being reintroduced to your activity. And so there's going to be different kind of guidelines that we're going to use for that than when we release someone fully for sport, of course. But one of the first things we'll look at is quad and hamstring dynamometry. And so limb symmetry index, looking at left to right, right to left, depending on the injured side, we'll aim for, we've found a couple of numbers, but 80 to 85% is a good reference to start with. Sometimes we'll see 70% for just return to run, but when we start to look at introducing direction changes, horizontal deceleration, we want that number to be a little bit higher in that 80 to 85 range. With the quad torque to body weight ratio, we have different benchmarks for returning to jogging, which when we look at Rich Willey and Eric Mira, we see at 1.45 at 3 months for just returning to light jogging. Return to actual running, more like 1.6 to 2.0. Reactive strength, which we think of as plyos, that should start to creep up to 2.5. And then return to sport 3.0. And we have an argument that maybe if someone's more of an elite athlete, that should be a little bit closer to 4.
Yeah, and it's worth mentioning, just since Mandie's referencing the torque to body weight ratio measurement, a little bit of background on that torque to body weight ratio test. So essentially what you're doing is using a crane scale dynamometer or a handheld dynamometer, but I think optimally it would be a crane scale. And you're setting that patient up and measuring in 90 and 60 degrees to get their maximum force output. You take that measurement and then you plug that into our calculator in addition to a measurement of their knee to their lateral malleolus. So that's your lever arm, right? So that takes you back to our physics prerequisites, right? So you've got your lever arm, you've got your force output, and then that's going to create a torque calculation for you, which you then will reference against their body weight. And that normalizes that data for that person's size. And as Mandie mentioned, takes into account this opposite limb that has also been deconditioning, so you're not, comparing one flat tire to another.
And when we look at that testing that we can do, there's a plethora of movement screen kind of data that you can gain, and everyone's going to have their way of looking at that, but we kind of want to make sure we include a little bit of a table exam, and that's a good time to look at hip range of motion and lumbopelvic movement, and then ankle range of motion, and then that can be taken into some more functional standing tests, which would be including the anterior lunge test for dorsiflexion against the wall, maybe single leg squat testing, single leg balance, plank movements, single leg and double leg squats, and just basically looking for any low hanging fruit that might be adding to any weakness or strategies that we want to clean up in the clinic before we send people back out onto the snow or to their sport of choice. When we look at the most common compensations, they sometimes can be a little bit more obvious when you do a drop test or similar to the LESS test, looking at landing or scoring system. And one of the more obvious things is looking at someone excessively flexing through their trunk instead of bending through their knee. Is there excessive knee valgum, anterior pitch of the knee forward, or excessive touchdown from the opposite leg?
Yeah, these are all things we've seen in the clinic, right? The person looks great from a strength testing standpoint, but when we actually have them initiate accepting some, more dynamic loads where they have to ramp up force production more quickly and really challenge that injured leg, whether that's a psychological challenge or it's a physical challenge that they can't meet, we're watching them, offload to the stronger leg as well. And so that favoring that side is really common, and all the other deficits that Mandie just referenced.
And when it comes to that torque to body weight ratio and LSI, we really like to see that someone has at least 60% greater quad strength to hamstring strength. There's an increase in re-injury rate for folks that fall below that number. So that is something that we find sometimes tends to fall in the category of people pushing quads harder than hams just because maybe they can see that muscle a little bit better. So just make sure you're not neglecting the hamstring due to their protective role of the ACL at its tibial attachment.
Yeah, that's definitely a really important thing to think about. And, Mandie mentioned some of the table testing and screening that can happen. That's part of your intake exam, where you're really either part of your intake exam or part of your kind of return to sport testing exam phase, where you're really examining the whole patient and seeing, how stable is the pelvis, how functional is that lumbopelvic system, do they have a solid platform for that hamstring to pull off of, and in many cases these athletes already had, they may have gotten injured in the first place because these imbalances existed prior to their injury, right? And that predispose them, and that's what we know from the literature, that these deficits that we're referencing that are part of these programs are really predisposing factors to injury. And so, there's so much emphasis placed on quad and the quad strength and the return of quad tone that we don't want you to overlook, things that are upstream that are really important for that proximal femoral control and the control of internal rotation. And then, like Mandie referenced, that the hamstrings being able to put the brakes on that tibia.
And we saw a lot in the research about the external abdominal obliques and the gluteus medius and that role during a drop test of those two muscles working in concert. And so some of that dynamic loading, we can make references or assumptions, but unless we actually look at it, we don't know exactly how someone's doing. And really, when we look at the change of direction, we want to be able to open people up a little bit when we have the space and can. And we have ways to modify that. But if you can throw in some cues externally that they have to respond to in a smaller space, then they can work through processing that, kind of that neurocognitive rehab as you go along. And as we go into kind of the hop tests, I think the biggest thing to think about there is that hop tests are not standalone tests. They really are part of the algorithm of this dynamometry testing and agility testing that we're going to do. But they can tell us a lot about how fatigable somebody is, and again, those kind of dynamic loads and how someone responds. So our kind of most common ones that we test in the clinic are going to be your single leg hop, your triple hop for distance, and then a crossover hop, and then the 6-meter timed hop test. And for skiers, there's sometimes a few others that I look at depending on the level that they're going to be returning to. So if they wanted to spend some time in the terrain park or they're a freestyle skier, we might do some of the standing rotation hop tests, double and single leg. But those first 4 that I listed are going to be kind of your bread and butter for the average skier that we look at in the clinic.
That's right. And then, so these horizontal hop tests have been around for quite some time. I guess really they just started being reviewed and released in editorials around the time we were doing our initial lit review for this project. And now are much more commonplace in the clinic, and we see them being done more consistently. Returning an athlete's quad performance is a huge part of their ACL rehab. We don't want to underplay that. And your best hop test to evaluate that, and something that is rising in the literature because of its sensitivity in assessing quad performance, is your single leg vertical hop test. The single leg vertical hop, being that it is vertical, requires much more of the quadriceps versus the horizontal hop test, which is really more of like a hinge and a thrust forward from the glutes and the hamstrings. So we're really encouraging people to take a look at that single leg vertical hop as a benchmark from the LSI kind of category or column of our testing that we're recommending, because again, it's highly sensitive, where you'll have athletes that test out 90% plus on the limb symmetry scale using our horizontal test, but then they will flunk that single leg vertical hop because of how much it emphasizes the performance of the quad. So there's a lot of different resources available to measure this. Here in our clinic, we're using force plates, which basically uses a calculation to determine what kind of distance or vertical that individual gets off of the plates. You can also use old school, video capture using like a measurement grid that is placed on a wall behind the athlete. There's also apps available, such as the MyJump app, which can be used to perform this test. Really, I think it just comes down to like what's most efficient for you and your practice, what's going to give you the best data. Because we just listed off a lot of testing. You could burn your whole session, doing horizontal and vertical hop testing and drop testing. So you really do need to match your testing to the athlete, what you think their specific needs are, what's going to give you the best data and inform your decision making in the best way, given that athlete's needs at the time.
Yeah, and like Mitch said, we really want to pick the hop test that's most relevant to that athlete. It also can be kind of a psychological readiness test. If someone stands at that edge of the tape measure and clearly doesn't want to hop, that can tell us a lot. And so much of how someone's going to be ready for that depends on what graft what graft was chosen, what underlying injuries they had besides the ACL, if there was meniscus involvement, MPFL. If gender can play a role on that, as far as like overall weakness of the hamstring, if a female has a hamstring graft versus a male. So just kind of keep that in mind as you're picking your exercises to prepare people for hop tests, and make sure that the hop test is the next step in the line of progression from whatever plyometrics have led to that choice to test those that day.
That's right. And so, we're just talking right now about some measures of dynamic control. There are also, like using some more advanced tools, there's more you can glean from, force plates that can tell you a lot about the athlete's rate of force development. And that's something that has been a really big part of our programming and Alpine Training Project, recognizing that injuries occur, like an ACL injury we've been shown occurs between 17 and 50 milliseconds. So really these milliseconds do count. And if your athlete is sluggish and slow, but strong, they're not necessarily going to be protected from that future injury and could be at risk of re-tear. And there's a body of literature that comes from professional soccer that demonstrated that athletes 6 months into their rehab will have full recovery of their MVIC, and so their strength will be there, but they still have profound deficits in rate of force development that persist all the way out into 12 months. And I think it's pretty strong corollary there, right, where we're seeing these athletes return to sports sooner and sooner because of advancements in reconstruction surgeries and different graft techniques that allow the athlete to develop their strength, get their range back, and pass their limb symmetry index testing and some of our hop testing, but they still haven't recovered that rate of force development in a way that's going to protect them from future injury. And it's really that those athletes that are released before 12 months that have a much higher rate of re-tear. So, if you're wanting to make that decision to return an athlete to a high level of sport or high level of intensity in their sport, you may want to dig a little deeper and get some data on rate of force development. That's part of why we've made the investment in force plates here, and we have a big emphasis on that in the program. So.
And one of the other things that we often test will be agility tests, like the pro agility test, and we've got the 505 and the 510.5. And some of that information can be standardized to some of the recommendations on time that are made by the NSCA. And we, as much as we can, want to compare those to normative values, but also when you have a chance to prehab with somebody, it can be a nice time to take some measurements so that you do have something to compare to, whether that be the contralateral limb while it's still strong and hasn't lost any strength from the time on crutches, to even the injured side before it's had the surgery on it, so you have some data to compare to when you go to retest. And when you retest, you can test often and test early. So don't feel like you have to wait until that 5 or 6 month mark to do the first set of dynamometry tests. That's information that can be helpful as we go along.
Yeah, I'm glad you brought up the prehab side of things. I think that's also a great opportunity for you to, dig into their biomechanics a little bit. We mentioned lumbopelvic system, but also, foot and ankle. How well does their foot meet the ground? Are there issues, are there deficits there? Are there issues with chronic instabilities in the ankle and the foot that are impacting that foot's ability to be a platform? So really thinking about, the foot meeting the ground, then our subtalar stacking, or the ability to stack the talus over the heel, the ability to align the knee over the foot in simple tasks that you can, just assess with single limb standing, and simple movement screening tasks that shouldn't be too aggravating to that injured side. So this is really your opportunity to kind of get to know their biomechanics, maybe get them working on some of those deeper issues and deficits prior to your focus shifting to, the post-op rehab and recovery. So it's always nice when you have a relationship with a physician that's, where you're going to see those athletes before surgery, and you get a lot of buy-in from your athlete as well. So yeah, we're big, proponents of the prehab side of things. When we talk about measuring rate of force development using force plates, I'm just going to give an overview of some of the things that you can dig into and how that's measured. If you have access to a force plate system, or if you've been thinking about it, here's a guide for you to get started with that. So we actually use the VALD system here. It's a lease system, so we pay a monthly lease fee. It's a nice, it really lowers the barrier to entry significantly if you want to get started with a system. And you can look at a lot of different things, but basically you're looking mostly at something called the reactive strength index. And then other tests have a measure called the modified RSI or RSI modified. They are different calculations and they produce different numbers, so you have to compare like with like. And so you're going to be, sticking with comparing your modified RSI test to other tests like that with the same numbers versus just the straight ahead reactive strength index. But what we're looking at there is measuring the performance of the stretch shorten cycle. So how efficiently does that athlete eccentrically lengthen the muscle, store energy in the connective tissue, and then release it for the shortening phase of that cycle? How quickly does it happen? You can also look at things like max force production. You can look at power, so how quickly are they generating force? And so those are all really effective measures. And you can use a side-to-side comparison as well with LSI, but you can also use their findings to compare them to gender and sport siloed norms. So there's a norms comparison component to the decision making that goes along with utilizing force plates. So a couple of examples would be a counter movement jump. That's basically you're starting from hands on hips, and then you're going down fast and up high is the cue, right? So you're trying to be very consistent with your cueing. It does inform their output, right? So that one, you are kind of bending down and you are utilizing that stretch shorten cycle. Another really great test for skiers in particular is a squat jump. And so that's where an individual is going to come down into a squat. They're going to hold it for 1/1002 and then have to generate force from that position without utilizing that eccentric and connective tissue component and that stretch shorten cycle. So it's really looking at force production from that kind of ski position. And we utilize that test by not only doing your standard kind of 6 reps, which is the standard that we have in place for force plate testing. So you'll do your 6 reps, and then there's some averaging that happens, and then you can kind of weed out certain reps that were a little off, but you can analyze them closely. But with the squat assessment or squat jump assessment, we'll have the athlete do 20 in a row to see if there's a fatigability component within their testing, and that's very useful. Especially because quad endurance and endurance in general it's really power endurance, right? Is the category that skiing falls into, because it's not necessarily an endurance activity like running or cycling, right? It's really power endurance. So it is more similar to other gravity sports in that way. Single leg vertical hop, like I mentioned earlier, is another test that can be done utilizing the force plates. Those tests that I just mentioned, they all fall under this category of explosive strength. So during this rehab testing process and program design process, we've really got like 3 buckets that we should have in mind. Bucket number 1 is max strength, right? And we're evaluating that with our limb symmetry index tests our torque to body weight ratio tests. And then if you have, the ability to do isometric testing using force plates, good on you. I think those are really great measures. So you've got your mid-thigh pull, you've got your squat isometric, single leg squat isometric. Those are all really great ways to measure for this bucket over here, this max strength, right? The next bucket is explosive strength, and that's what we're testing with our counter movement jump, our squat jump, and our single leg vertical hop, right? So that's how efficiently can we, from a feet on the ground position, generate rate of force development, so speed, how much power can we produce, how high can we get. Those kinds of measures are what we're looking at with explosive strength. So then the last bucket, it's over here. The last bucket is reactive strength, okay? And that's our drop jump test, right? So that's how well do we take impact from a landing and then store that energy and release it through our stretch shorten cycle. And so there are a lot more ways to look at reactive strength qualitatively, right, with some of our drop testing and some of our lateral movements that we can evaluate to see how well they stick the landing after a lateral perturbation or a lateral hop, things of that nature. But within the force plate world, we have our drop test and our single leg drop jump, which we're all pretty familiar with. I think I've seen that in a lot of programming, right? I mean, I see it at the gym, probably way too early. If I'm going to get out of my soapbox, I see people in the gym, they're like, okay, I'm ski conditioning. And so what do? They just start by hucking themselves off a box, right? It's just too much too soon. We see that in all kinds of programs out there, not to I won't name any names, but unfortunately we all see each other's failures, right? And that a lot of ski conditioning programs bring people up too quickly into the impact phase without really considering, have they put enough load on the system to harden those tissues and get them ready to be able to tolerate that kind of loading and for their body to be ready to then respond and react appropriately without developing bad patterns. So that's a little bit of a sidebar, but a decent segue actually into our next part of the talk. And that's, first we're going to just discuss what are the criteria that individuals need to meet in order to transition into that sport specific phase. And then I'll talk about what we do in the Alpine Training Project to first follow the guidance that's there in the literature, and then then use our evidence-led approach, right, to develop activities and techniques and programming essentially that is effective for skiers, right? Because it's going to be different from another kind of athlete.
Right. So kind of going back to defining the parameters for the sport-specific aspect of training, we looked at the buckets of the max strength, and when we look at the LSI and torque to body weight ratio, we're going to aim for 80 to 85% LSI for quad and hamstring for just that return to sport. But we'd like to get up closer to 90 to 95% to actually return to full sport or skiing. So
just to clarify, it's 80 to 85%. You said return sport, but sport-specific phase of rehab.
Yes,
yeah.
Sorry.
So maybe just start over. Start from LSI.
Okay. So let's see. So going into that first bucket as kind of a review of those parameters, LSI for just return to the sport-specific phase of training, we recommend 80 to 85% per the research of the opposite limb, and primarily quads and hamstrings are what we test in the clinic, and then that should be closer to 90-95% for return to sport. But since we're looking at the return to sport-specific training, for torque to body weight ratio, we have some values that I just wanted to review. So return to jogging, so like a return to run program, 1.45 Newton meters. Return to running would be 1.6 to 2.0. Reactive strength, so plyometric training, 2.5. And then return to sport would be 3.0. And if someone's returning to sport as their profession, we argue that could be closer to 4.0.
Yeah, especially for skiers, right? I mean, it's such a quad heavy activity that, if you're a professional skier, we would like to see you, pushing up close to 4.0. So that's what we've seen here, testing some of the athletes that have been through our facility. Good to know, right? Like 2.5 for your torque to body weight ratio is a really important bar to clear before we get to that sport specific phase, because we are going to start working on reactive strength in this phase, right? Where, there are going to be some impacts, and we are doing plyometrics in this phase, because that's, as the evidence has guided us, is plyometrics are a really big part of that dynamic control component of return to sport and prevention of future re-tear. So with that, I'll segue into what elements we should have in our ski programming, our return to ski programming. So it's a little bit different for skiers because we have, that power endurance demand of the sport, right? So quadriceps not only needs to be strong, but it needs to have a good deal of endurance, and it needs to have a great deal of eccentric capacity, because skiing is such a braking, it's a gravity sport, it's a downhill activity. So your quads are constantly putting the brakes on for you and helping you to power up those edges in combination with some of your rotational muscles from your core and from your hip system, right? So, so if we were going to just kind of put bullets on it, it's definitely, return to sport phases, we're definitely going to start hammering on those quads, especially if our goal is to get you to about a 3.0. I think it is important to reference norms for age and gender too when you're making these calls regarding to torque to body weight ratio. There are some of our athletes here in the clinic that maybe just they just want to get out and ski blues, and maybe they're into that into their 50s, and they just don't necessarily need to meet the same criteria. Somebody's hard charging and doing drops and airs and pushing hard in the backcountry when how sound their knee is a part of the safety component of your decision-making tree there. So it's good to kind of bring that up. Back to quadriceps, right? Eccentric control and endurance. So those are huge things. So we have within the Alpine Training Project developed a 13-point screening system where we have just some really basic benchmarks for individuals to meet. And our squat endurance, it's at least 90 seconds of being able to hold a nice deep thigh parallel squat. For eccentric control, that's a lot harder to measure with a screening test, right? It's just very hard to measure somebody's progress towards that. So it is just something that it needs to be a strong element in the program. And you need to really know your athlete and know what buttons to push in terms of sets and reps and volume. There is this temptation to create programming that is just like all about just pushing your athlete to the edge, and we're doing 90-minute rounds of plyometrics and getting their heart rate up into the top end, and that in itself is very rewarding. And yes, like cardiovascular conditioning is important, but if they have rate of force developments, we know that the best way to develop speed and that rate of force development component of their training is really to cut back on your reps significantly. So you're looking to do like 3 to 5 reps within 3 to 5 sets and 3 to 5 exercises that address, the movement patterns that they need to get quicker in. And that's something I've seen with some of the athletes that have come from other facilities here to be tested. I've seen they have great programs. They've done a great job at filling up the max strength bucket, right? They're lifting very heavy, and they've really gotten quite strong, and their endurance is good. But the control and that rate of force development aspect, that reactive strength is not there because they've just gotten so strong and slow. Because, when you're lifting heavy, you're moving slow through those reps, right? And your body does exactly what we tell it to. So I just wanted to emphasize that a little bit as some of, your thought process there and give you some criteria. Within our online program, we do kind of, have to kind of like shoot for the middle, right? A little bit when how we prescribe our series and the HIIT style workout, right? So that we prescribe to everyone. So you do end up with kind of your more standard like 60-second intervals, which is good. It's definitely far better than not addressing that. But if you've got an athlete, that has a high performance need, you might want to, calibrate your prescription accordingly. So definitely we want to hit the hamstrings in that max strength bucket, because we do need to, help them meet the strengthening, and the power that the quads are receiving. So definitely there's a good deal of hamstring programming in our series, and just depending on where that athlete is, you got to pick the right activities, because hit them too hard with hamstring strengthening can be really uncomfortable, right? And it can be a vulnerable area. So you just really read the athlete, don't go right into Nordics, because, this is really high eccentric load, and it's a great exercise. We've got a great body of evidence there. We have it in the program for sure, but we don't bring it in as the first exercise, right? So scale appropriately when you're choosing that. And then there's a lot of hip lateral rotator isolation exercises to, kind of address the find and fire issues that a lot of athletes will come in with, especially if, they had really poor lateral hip control, and that was part of how they landed in our, facility in the first place. But we also are really just trying to bulk up those muscles so they're ready to meet the demands of the support. So gluteus medius, minimus, deep hip lateral rotators are kind of some of our key targets there. But it's, depending on the exercise, it's kind of hard to like point to just one being the main actor. So we reference strength, mobility, and motor control. So under the mobility piece, that's really where we're cleaning up some of your biomechanical faults. So, if somebody has restricted ankle dorsiflexion, even though we're locked up in a ski boot, it can be an issue. I mean, I've actually been really shocked at how many athletes I've seen with Achilles tendinopathies and heel pain issues related to some of those, restricted ankle mobility situations. And it wasn't when I started down this path something that I see a lot of, but it definitely is something that comes into the clinic. And right, if you're not accessing your ankles, what's the next thing up in the system? You're going to be either overtaxing the knees by slamming that femur back into the back of the patella with some of our patellofemoral issues once that ankle stops moving, and then also it's going to drive people back into their hips and sometimes throw them off balance and really give them some issues with accessing their hips. So there really should be equal distribution of motion between the ankle, hips, and the knees. And so hip mobility is also a big factor for certain individuals. If you're not moving well in your hips, right, you're going to push right down into your knees. And often there's some sort of motor control deficit that goes with that stiffness, right? We've seen that in tons of research. So we talked a lot about dynamic control. We talked a lot about rate of force development, and just reiterating one last time, LSI scores. So if you're using limb symmetry index testing, using crane scales, and that's your baseline measure, then, before we get into that explosive strength category, we want people at least 80%. So once they hit that 80% mark, then we can start working on, vertical hops to a surface, right? So that's where you can start utilizing that box jump and start working on their ability to build some explosive strength. And then once they get, to 90%, that's where you can start dipping into that reactive strength category. So with that, we'll just talk a little bit more about testing.
And, for my career, I started out actually in spinal cord rehab and a trauma center for just a year and a half. But, the majority of my career has been an outpatient. But I feel like what that experience gave me was really seeing what people could come back from. And when Mitch was talking about looking at, the above, upstream, downstream, I feel like that is somewhere where we can really, really get someone back to the top of their game and maybe even stronger than ever before they in their injury if we do the right assessments. Proprioceptors in looking at how they move and maybe what led to their injury in the first place. The first outpatient clinic I worked at still had one of those Biodex machines, and so we actually early on were testing people for return to sport, and then it kind of went out of favor for a little bit, and now it's back with these portable units, and so that's no excuse really not to do that in your clinic. And the Biodex machine I used to use ended up in a research university and is still being used. But one of the things that I have noticed is back when we were doing that is people were strapped at the thigh and their hands were in their laps, and it was very specific about where you could move from. And so I think keep in mind that if you can make your testing as consistent as possible every time you do it, we want to make sure that we don't create error in our testing and send someone back to return to sport activities sooner than they should because of our not being clean in our testing. So keep that in mind. Make sure that you're doing it on a day that you're feeling you have the time to set someone up and take them through the proper commands and not rushing through that step. Yeah,
that's a great point. And it actually brings to mind too, like to reiterate some of the importance of just some of our basic exam skills, some of our basic orthopedic exam skills. And as we're, pushing out into some newer territory with some of these measures and our force plates and our emphasis on load and these 3 buckets I was just talking about, we can't lose track of our table testing and our basic orthopedic manual therapy exam skills. Like I mentioned before, a sound lumbopelvic system is absolutely essential to being able to generate force off of that platform. And you'd be surprised at how often I'll get patients on the table and find an SI joint dysfunction or an ankle instability, and this is their, maybe their second surgery that they're recovering from, and they'll tell me that, I've rehabbed 2 injuries now and nobody's put me on a table to examine me. So I think that's kind of my call here to, while we're in the context of discussing, testing and training, we don't want to lose sight of some of our basic skills, and we do want to really see the whole patient and see that whole biomechanical system. And it does take some additional time, and it does require that some of you who were not brought up in that world go out and learn some additional skills. And myself, my background, I'm an orthopedic manipulative therapist, and that was really where I started, and I've had to backfill in the loading side of things. And I think, if I was going to point out probably my weak point is I'm a little bit slow to load patients sometimes, or maybe could get to that a little quicker because of that background. But at the same time, I'm not going to miss some of these things that are hampering their ability to layer strength on top of the system. That also brings to mind, actually, I didn't even address this in our programming phase, but core strength, right, is so essential. And definitely, our frontal plane control. So Mandie mentioned the obliques, abdominal control, lumbar multifidus are huge. That's something we hit a lot in the program. And we do it in a really thoughtful way. So we really try to make sure the patient the patient can find and fire, and then that we're building a really solid, deep core foundation to layer all that strength on top of. Because if you don't do that properly, and the person has dysfunction of the spine or pelvis, hip, ankle, whatever, you're layering that strength on top of dysfunction. And a lot of times you get away with it. But a lot of times you don't too. And it's really where you can make quite a big difference for your patients if you really are thoughtful about your progression. And again, you see that whole patient, that whole movement system that's involved with the activity of skiing, which is really like, there's some arm components to skiing and snowboarding, but really it's, kind of from your 5th thoracic ring down, right? So, where your abdominals are attaching up into your rib cage, and everything you can strengthen from there on down. But yeah, really making sure that frontal plane system is working well, because that's where a lot of our edge control is coming from, and that's where we need to be quick too to get our knee out of trouble as well. So a couple points to touch back on there. So as far as testing is concerned, we touched base on our exam calculator. So that's where you can dump your dynamometry scores into for quad and hamstring, and then generate, all you need is body weight and the length of the lower leg, right, from the outer knee to the lateral malleolus to get that lower leg length, to get your torque to body weight ratio calculation. So that, and then a place for your hop tests is included in there. And so that's kind of that's the educational component of this webinar. And we'll close just by talking about our instructor training program. And so, like I mentioned, this is something we've just started to roll out with Alpine Training Project. Over the last few years, we've rolled it out in kind of like a beta format, where we've just used word of mouth to get the word out to friends, colleagues, other facilities outside of the state of Washington. And now we're in 4 states, Montana, Oregon, Washington, and Vermont. We're very happy to have some increased reach. We hope that you find some of this content interesting. I hope it piques your interest in the instructor training program. We've really found that, the best way to attract the clientele, attract the patients that you want to treat, the ones that motivate you, the ones that make you want to go and read about stuff like torque to body weight ratio and really push your understanding of performance testing. The best way to get those patients is to offer them something of value and to build community around your clinic. And that's something we've really been effective in doing here in our clinic in Seattle. And we're very happy to have built that community. It happens just a little bit at a time. And a lot of that has happened through our ski conditioning class that we offer. We now are offering it, we offered it 4 days a week last year. And essentially what you're committing to is a 4-hour CE generating training course or onboarding course, and then teaching 6 classes to ramp your students into their preseason preparedness. You teach the class once a week. We support the evidence-based recommended 2 to 3 workouts a week by supplementing with our online programming. So we try to make it really easy for you as the instructor to be successful. So we're mindful of what equipment we're asking you to have in your clinic. We make that all very clear before you sign on. And so we're mindful of what you have, what most people have in their facility. And so we've really tried to design the program with that practical piece in mind. And so, basically you do our 4-hour-ish onboarding course. It's really 3 hours of lecture. I had an awesome case of laryngitis, so you should just watch it just for that when we recorded that. And so, from there, we give you 3 hours of didactics, some of the background, some of the research we've been touching on here, like really what evidence did we use to inform our program development. So some of the theory, what you're looking for when you're teaching the class. And then we actually teach you how to teach the class. And so we have developed a number of resources for you to just make it super plug and play, right? So we have, once you've done that training course, we do a Zoom meeting, and then really it's 30 minutes of reviewing the notes on what content is going to be in that class. We have videos for every exercise you're going to demonstrate. And then so, whenever your clinic space becomes available to do your class, then you're going to go ahead and, clear the space, get your station set up, since we have this in-person class set up as a circuit. So we have essentially 12 stations. And so the nice thing about the circuit is that it's very easy to teach. So from that circuit style format, it really just allows you to onboard very easily. So it's just a matter of, in terms of what you need to do as the instructor for that class, is just to know the stations, know the exercises, demonstrate a few reps of each exercise so that people know how to do the exercise, and then you spend the rest of your time monitoring the stations and giving people form cues to help improve some of that dynamic control. So essentially the class runs for about an hour. You got your half hour of prep, and then you have your half hour breakdown at the end. So we look at it as about 2-hour commitment once a week for 6 weeks. And so for your hard work, we offer a revenue share. And essentially, all the registration happens through alpinetrainingproject.com. And any of the revenue that comes in association with your class participants, we have essentially like a 60-40 revenue share minus any of the processing expenses, so credit card fees, et cetera. And so we also provide you with a marketing packet. So we're gonna have, pre-made posts for you to put out on your socials. We have signage ready to go for you. So from that standpoint, it is also plug and play. And we've, like I said, we've been doing this beta version of the program for a few years now. And we've onboarded a number of instructors who are starting from scratch, just like you will be, and who've been totally successful in getting their 12 participants. And, it ends up being a really nice take home at the end of the day. It's far better than your hourly that you're getting, through your treatment day. And you get the benefit of, improving your understanding of ski-specific training. You got a whole bunch of new exercises you can work on with your patients, even if they're not skiers per se or returning to skiing. And then just that final piece of like building that athlete community, building that following of athletes, and really, getting to engage in, the population of patients who love the same thing you love, right? Which I find to just be super rewarding, super motivating, and just great for the energy in your clinic in general. So if that all sounds interesting to you, you can go to alpinetrainingproject.com, and then you can essentially find our group classes, and there are, there's a form for you to fill out to let us know that you're interested. At that point in time, we'll review your initial application and just see, like, do we think you're a good fit for ATP? And, essentially, what is the criteria? We're looking for somebody who has, a background in snow sports and, has, if you have some exercise physiology background, and you have some training background, that's a total bonus for us. But we want to bring on board instructors into the program, that really know the athletes and are going to really present this product really well for the athletes that you're working with. So, but please don't feel like, oh, I would never get accepted. Please just submit your application. It's, our barrier to entry is not super, super steep, but we are looking to curate like a specific kind of instructor. Like I mentioned, you get 4 hours of CE through the onboarding process, and there are some fees associated with that. We'll let you go to the website and discover what those fees are, because they're going to be evolving year over year. But if it's far less expensive for return instructors. So once you kind of have that initial onboarding cost, we cut the cost way back. But we make it well worth the 4 hours of CE. So that's a pretty good overview of the program and what you can expect. We hope this information is helpful for you, and reach out to us if you feel like there's more interest for in-person CE or any future CE events. We'll take your information down and keep you on our mailing list as we continue to work on this program every year. Like I mentioned, this really has been a labor of love for us. I reached out to Mandie because I knew she was, a fantastic backcountry athlete and skier and endurance athlete, and then, obviously her background in with the U.S. ski team. And we really started this out because we were both interested in, I was interested in backcountry snowboarding or splitboarding. I knew she was interested in backcountry skiing, and that was really where we started this program. And I think that tells the story of what drives us. And it's really like the passion for the sport, passion for time spent in the mountains, and that's really what is the driving force behind this program. And we just really want to help people get out there and just have their best season yet every year. I know personally, I've been doing the program at, they call it dog food, when you develop something and you do it yourself. So I've been doing it every year. I'm 45 now, and I haven't really lost a step. So I can say that I'm, snowboarding and now skiing, as strong as I was, 10 years ago. So there's my own personal testimonial. Thank you for your attention, and we'll look forward to hearing from you on atp.com. Thanks.